Now welcome to another series where we're covering menopause and we're talking about menopause treatments. Now in my previous video I talked about treatments of menopause and focused on HRT. Now we're going to talk about natural products of HRT, and this includes herbal medicines and other complementary therapies. So in terms of menopause, a lot of women will find that lifestyle changes are very important. So we're talking about exercise, weight training, which is good for the bones, reducing alcohol, reducing spicy food intakes, plenty of sleep, relaxation, and especially for women who have mild symptoms of HRT, this is more than sufficient in managing their symptoms. However, there are some symptoms that are quite predominant, such as your hot flushes and night sweats, for instance, and a lot of women would not want to go onto HRT for whatever reason, or maybe they're not able to use HRT if they've had a previous history of breast cancer or DVT or strokes, and they would want to consider an alternative treatment. Now, if we look at natural products usually contain what we call phytoestrogens. Now, phytoestrogens are basically plant derivatives that have estrogenic properties, which are as close to your natural estrogen as much as possible. Phytoestrogens are shown to be quite useful in treating hot flushes and other symptoms of menopause, and they're usually found in our natural diet. I've given you a list of some of the foods, which include linseeds, flaxseed, legume plants, pulse, beans, nuts, soybeans, which contains isoflavones, which contain phytoestrogens. However, you will need to eat these foods every day to get as much estrogen as you would get from a tablet of HRT, for instance. For example, with soy products, which contain isoflavones, you've got food forms, which mainly are your tofu and your soy milk. Flaxseed in the ground form is thought to help more with the symptoms of menopause, and not the oil form of flaxseed, and is usually taken as 40 milligrams a day. Then you've got sage, which is also known to reduce hot flushes, and there was a study done in postmenopausal women which showed improvement in hot flushes after just 8 weeks. However, sage is also known to contain a compound called thujon, which can cause increased risk of liver failure as well as seizures. So it's advisable that you take the recommended dose of sage and not to overexceed the dose. Now, you've also got various menopause supplements that you can find over the counter, and one of the common examples is what we call menopace, which contains all the necessary vitamins and minerals you need, as well as soy extracts, sage, chamomile, which are thought to help with hot flushes, poor sleep, and other symptoms of menopause. In terms of herbal medicines, these are not really recommended, as we do not know how much estrogen are in any of these medicines. For example, you've got St. John's wort, which are thought to help with mood swings and hot flushes. You've got red clover, and which can also be found as a 40 milligram supplements in pharmacies, and are thought to help with skin diseases like eczema, psoriasis, blood pressure, joint pains, and other symptoms. You've also got black cohosh, which helps with hot flushes, night sweats, palpitations, poor sleep. However, it's commonly known to cause liver failure and vaginal bleeding. So one has to be very careful with herbal medicines, because no one knows the long-term benefits, because the only evidence is for short-term benefits. There has been no evidence that if these medicines are taken for more than 12 months, they will continue to help with menopause. Also, there are issues regarding the safety and efficacy of these products. No one actually knows the amount of estrogen that they contain, so there is also increased risk of breast cancer, DVTs, and strokes. And you also have to buy from a recommended shop, because you don't know if what you're buying has got the good purity, quality, and constituency of what you need. If also you're on prescribed medication, you would obviously need to discuss with your GP or the pharmacist before taking any herbal remedies, because you do not know what interaction you'd have with these medicines. For example, if you're taking a blood thinner such as warfarin, it's advised not to take St. John's wort, because this can increase your risk of bleeding. Now, some women will find that complementary therapies such as aromatherapy are quite useful for symptoms of menopause. You've got your essential oils like your chamomile, which has a calming effect. You've got lavender, which is quite useful for sleep. However, do remember, there is no strong evidence base for any of these treatments. So I hope you found this quite useful. Feel free to check out my other videos on menopause, and feel free to share. And please drop some comments below if you have any questions.